The COLOR II trial, 2013, a landmark study in rectal cancer surgery. Welcome to our in-depth exploration of the COLOR II trial, published in 2013, a pivotal investigation that shaped the landscape of rectal cancer surgery. Today, we will unpack the essential findings and discuss the broader significance for patients, surgeons, and the future of minimally invasive approaches. Setting the stage. Purpose and patient selection. The COLOR II trial was conceived as a multi-center, randomized, controlled study designed to evaluate whether laparoscopic surgery for rectal cancer could match the safety and efficacy of traditional open surgery. The main focus was locoregional recurrence, that is, the return of cancer in the area surrounding the original tumor. Researchers also examined short-term clinical outcomes, survival rates, and the quality of surgical resection. Over 1,000 patients took part in the trial. All participants had solitary, primary adenocarcinoma of the rectum, specifically located in the middle or lower third of the rectum, no further than 15 centimeters from the anal verge. Importantly, only those without distant metastases were included. Tumors were preoperatively staged as T1 through T3, meaning they were considered potentially curable with surgery, and many patients received preoperative chemoradiotherapy. Randomization and group assignment. Patients enrolled in the study were randomly assigned to two treatment groups. One group underwent laparoscopic surgery, and the other received open surgery. The randomized design ensured an unbiased comparison of outcomes. Key findings. Perioperative outcomes. Let us begin with the short-term results. Patients in the laparoscopic group experienced less blood loss during surgery, regained bowel function more quickly, and required less pain relief than those in the open surgery group. Hospital stays were also shorter for those who underwent the minimally invasive procedure. Despite these benefits, the rates of complications and mortality within the first 30 days after surgery were similar between the two groups. Oncological quality and long-term outcomes. Turning to the core question, was laparoscopic surgery as effective in preventing recurrence as open surgery? At the 3-year mark, both groups showed identical rates of locoregional recurrence, 5%. This demonstrated that laparoscopic surgery was not inferior to open surgery with respect to cancer control. Further analysis revealed no significant difference between the groups in terms of disease-free survival and overall survival during the same follow-up period. The study also examined the quality of surgical resection by assessing the circumferential resection margin, which is a critical measure in rectal cancer operations. Both laparoscopic and open surgery groups had similar rates of clear margins, and the percentage of complete or nearly complete specimens of the mesorectum, the fatty tissue surrounding the rectum, was comparable between groups. Distal resection margins, another important indicator, were adequate in both sets of patients. Conclusion and impact. The trial concluded that laparoscopic surgery for rectal cancer is not inferior to open surgery when it comes to cancer recurrence. It provides the same oncological quality while delivering the added benefits of minimally invasive techniques, such as faster recovery and less post-operative discomfort. Broader significance and important considerations. The COLOR II trial stands as a landmark study, confirming that laparoscopic surgery is a valid and safe option for patients with rectal cancer. When performed by highly skilled surgeons in specialized centers, this technique matches traditional open surgery in cancer control while improving patient recovery and comfort. There are important caveats. The surgeons participating in the trial were exceptionally experienced in laparoscopic procedures, which is crucial for achieving such positive outcomes, especially given the challenges of pelvic anatomy. Additionally, the study population mainly included patients with tumors classified as T1 through T3. Results may not directly apply to those with very advanced or low-lying tumors that require extensive dissection. Longer-term follow-up, reported in subsequent publications, continued to confirm the non-inferiority of laparoscopic surgery in terms of survival and recurrence. Thank you for joining us as we explored the COLOR II trial. Stay tuned for more insights into advances in cancer care and surgical innovation. It's the Everything Surgery Podcast. Dissect the extraordinary.